Alrighty, so we're going to go ahead and get started on our COVID-19 update for this evening. Hello, everyone. My name is Stephanie. I'm the Communication Specialist at the Yakima Health District. Hola a todos, muchas gracias por acompañarnos hoy en nuestra actualización de COVID-19. Nosotros tenemos esta actualización en español hoy, después de esta, a las 7 aquí en vivo en Facebook. So there are lots of updates on COVID-19 vaccines and boosters and the importance of getting vaccinated, both against the flu and against COVID-19. Also, with holidays approaching, we also want to provide an update on how individuals can safely gather during these celebrations. So this evening, we will have Dr. Neil Barg, our health officer at the Yakima Health District, and Erica Ochoa, community health specialist at the Yakima Health District, to speak more on these topics. And if you have any questions about COVID-19, please make sure to leave them in the comment section, as I'll be the one monitoring it on Facebook, and we can try to get those answered here during this live update. If we're not able to answer them during this live update, then we can answer them at a later time via a direct response to your question. So before we turn to our guest, I just wanted to give a brief update on our COVID-19 trends, vaccinations, and where to find COVID-19 data. So as of October 26th today, Yakima County reported a case rate of 528 per 100,000 and a hospitalization rate of 8.9 per 100,000. So while this case rate has decreased over time, we are still experiencing high levels of community transmission, which is why it's definitely important to continue to get vaccinated and follow those public health recommendations, which are get vaccinated as soon as possible, wear a mask when you're in indoor public settings, as well as when you're in outdoor crowded areas. It's very important. And also wash your hands frequently and sanitize surfaces frequently. Also, don't forget to practice social distancing. That will definitely help, especially if you're in line at the grocery store buying groceries. It's definitely important to continue practicing those and limit gatherings with those outside of your household, or if possible, gather virtually. And if an individual from a household gets infected with COVID-19, it's crucial that that individual isolates away from others in that household. So I'm going to go ahead and share my screen just to provide more information on our data summary page. This is where we have more information on COVID-19 and just talk a little bit more about that weekly report that we are doing every Monday. Okay, are you able to see my screen? Yes, okay, thank you. So here is our data summary page, and we are doing now a report on our COVID-19 trends here in Yakima County, and this one is updated every Monday. If you scroll a little below, we also have more information on the COVID-19 data dashboard, and also our daily graphic that we do update here on our website every day, Monday through Friday, and also post on our social media. And there's also more of a breakdown on their case count by age range too. But for that COVID-19 report, this one we update it every Monday, and it just has a lot more information on our case rate, hospitalization rate, breakthrough cases, and COVID-19 trends here in Yakima County. And an important data to know is that unvaccinated individuals still account for most COVID-19 cases and hospitalizations, which is why it's so crucial to get vaccinated, because we know that the vaccines help reduce severe illness, hospitalization, and death. But here's where you can find that report. And again, this will be updated every Monday. And another one I wanted to share also is how we're doing with our vaccination rates here in Yakima County. So as of October 23rd, Yakima County of individuals 12 years and older, 70.0% have initiated a vaccination and 62.3% have been fully vaccinated. And soon we may be hearing more updates on the Pfizer COVID-19 vaccine being approved for individuals 5 to 11 years old. And throughout Yakima County, there are still lots of opportunities to get vaccinated. Here, I'm going to go ahead and share our COVID-19 vaccine page. There's a lot of opportunities to get vaccinated. Here is a list of our mobile units that are updated every week, and there's availability every day of the week. Here at the mobile vaccine units, we are offering the Pfizer vaccine, the first dose, the second dose, and the booster dose as well to those who are recipients of the Pfizer vaccine. And if you want to see if you're eligible for a COVID-19 booster shot, here there's a little bit more information on who is eligible and when you should get your booster dose, depending on when you received your second dose of the Pfizer vaccine. So it's definitely important, great resource here. And we definitely want to encourage the community to take advantage of all these vaccine opportunities that are occurring in our community. And it's not just in Yakima, there's also locations in the Lower Valley, such as Sunnyside, Granger, lots of opportunities to get vaccinated. And another one last thing that I did want to share is our COVID-19 testing page. So now we do have, there is availability of COVID-19 testing at 3 community-based testing sites. There is the Yakima Valley College one, the Yakima State Fair Park, and the Sunnyside Community Center. These are free to the community, no appointments are required. If you would like to sign up ahead of time, there are registration links here that you can access. And here are their hours too. There's availability every day of the week here in Yakima, and in Sunnyside, it is open from Sunday through Thursday. It's important for individuals to get tested if you experience COVID-19 symptoms. And while you wait for those test results, please isolate away from others as well. And with any of the vaccine opportunities here in Yakima County or any of the testing sites in Yakima County, you can also call 211 to find out that information too. And they'll be able to provide you more information on the vaccine mobile clinic or a testing site that is near you as well. Okay, so I am going to go ahead to see if we have any questions before we jump in to one of our guests tonight. Okay, it looks like we don't have any questions at the moment. So we'll go ahead and begin with Dr. Barg. Dr. Barg is our health officer at the Yakima Health District. Thank you so much for being here. To begin, I would first like to talk about the flu and the importance of getting the flu vaccine. We know that COVID-19 remains widespread in our community, and we may see more flu activity this year compared to last year. So why is it so important to get vaccinated against the flu this year?
It's always important to get vaccinated for the flu. The flu vaccine isn't perfect, but if you get vaccinated, the chance of getting seriously ill and getting hospitalized is much, much less. So there's also a possibility you could get both flu and COVID, and they may act together to make you even sicker than you would get with either one alone. The flu vaccine has no components in it that the COVID vaccine has. So they're completely different. There can't be any cross-reactivity because there's nothing common between those two vaccines. So if you don't like the reaction you have to the flu vaccine, you probably won't have that reaction when you get the COVID vaccine. The other really nice thing is you can get both vaccines at the same time because there's no interaction after they're injected either. So it makes it really convenient if you go to a place that has both, like a drugstore or a clinic. You can kill 2 birds with 1 stone. So both of them are great to get. And we think flu is going to be worse this year because people are more lax with wearing masks and social distancing. And flu spreads the same way COVID does.
Thank you, Dr. Barg. And it looks like we do have a question from those that are watching us. So Katrine asks, will there be mobile COVID-19 vaccine sites for individuals 5 to 11 years old? So we are still waiting to hear more updates on the Pfizer COVID-19 being approved. So we'll definitely be on the lookout and we'll provide more information once we have that. Okay, so we're going to go ahead and go on to our next question, Dr. Barg. We do know that we are have more information and updates on the vaccine booster doses. Who is currently eligible for a booster dose for the COVID-19 vaccine?
So most people that are young and don't have any underlying medical problems don't need the booster, but there are numbers of people that are at high risk. The first group is people that are 65 and older because they're more likely to get seriously ill and end up in the hospital. Although the original 2 doses of the vaccines or the 1 dose of the Johnson & Johnson do protect you from getting serious illness, but it's not 100%. The other people who are being boosted are those that work in long-term care facilities, because if they get COVID, even a mild case, they could spread it to older people that live there. And those older people can become ill as well even if they are vaccinated, the risks are just higher in going towards more serious illness. Anybody who has an underlying medical problem or has increased risk if they're, say, homeless or in jail of contracting COVID, they also are eligible to get a booster. So, like I said, most people don't need it, but it's very easy to determine whether you're in one of those groups.
And for those that are eligible, since we did go over that criteria of who was eligible to receive that booster dose, why is it definitely important to get that booster dose? Why is it necessary?
So when you have an underlying medical problem, your immune system doesn't have all its cylinders going at the same time. So the response to the original COVID vaccines may not be as high as it would be in a perfectly healthy patient. So your immunity may decline faster. So if you get the booster, it helps the immune system to fight the virus better than if you don't get it.
Thank you, Dr. Bark. And we do have more information on our yakimavaccines.org page on who is eligible for that booster dose. So go ahead and look at that information. Again, it's yakimavaccines.org, or you can also call 211. And another question that we do have, and we have been hearing in the community, is can fully vaccinated people still get COVID-19?
That's a great question. And it turns out that if you're not vaccinated, your risk of getting COVID-19 is extremely high. If you only have one dose, it's high, but not as nearly as much as if you're unvaccinated. And those people are only partially immune. So they're not real breakthrough cases. They're just cases that occur in people that aren't fully vaccinated. And if you're fully vaccinated, there are also breakthrough cases, but very few of the breakthrough illnesses make the patient sick enough to go into the hospital. And even a smaller number get into big trouble. So the numbers greatly favor getting vaccinated, and breakthroughs happen with any vaccine. So with all the people that have been vaccinated so far in our community and nationwide and worldwide, the number of breakthrough cases are only a small percent of the people who get vaccinated. Everyone knows about breakthrough because so many people got vaccinated.
And yes, we do know that the vaccine isn't 100% effective, but it does reduce your risk of severe illness, hospitalization, and death. And that's why it's important for all of us to continue doing our part and not only getting vaccinated, but also implement those public health recommendations in our everyday lives, such as wearing a mask, social distancing, washing your hands. All those will help us, especially with holidays coming up as well and celebrations and gatherings occurring. Okay, I'm going to take a moment here to see if we have any questions from the audience. Again, for those that are watching us, if you do have any questions on COVID-19, upcoming guidance for celebrations this fall and winter, please go ahead and leave them in the comment section. We can try to address those here in our update. Okay, so it looks like we don't have any questions at the moment. And another question I do have for you, Dr. Barg, and then we'll move on to Erica, is how long does protection from COVID-19 vaccine last? Do we know?
Well, that's still evolving. One thing we do know is that the antibody levels start to drop after 6 to 9 months. However, that does not leave you unprotected. One of the effects of the vaccine is to derive cells that actually have memory to the challenge that happens when you get infected with COVID. And this occurs in other vaccines as well. So even if you don't need a booster, your chance of getting seriously ill 6 to 9 months after you get the original series is far less. At some point, they'll figure out what the best marker is for decreased immunity. But the only thing we know now is that the antibodies go down, but we don't know what that means clinically yet. We may know in a year.
Thank you, Dr. Barg. Alrighty, so it looks like that is all the questions for the moment here. And now we're gonna go ahead and hear from Erica Ochoa. She's our community health specialist at the Yakima Health District. Thank you so much, Erica, for being here. And we do want to talk a little bit more about celebrations this fall and winter that are approaching and how people can prepare safely to gather with others.
Yes, thank you, Stephanie. Thank you, Dr. Bark, for sharing that information with us. And it's a little bit of what we were sharing last year. So not too many new things, but the best thing we can do that is new compared to last year is getting vaccinated. So the best way to prepare for upcoming celebrations is getting that COVID-19 vaccine or completing the series if you've started and maybe moved or, were for one reason or another not able to complete your 2 doses. Great time to get that completed. Getting vaccinated can provide you with additional protection while traveling and gathering with others as well. And it can help protect those around you who are not yet eligible to receive the vaccine. Another thing that everyone can do, preparing for to stay safe during celebrations, is being mindful of any symptoms. If you're starting to feel sick, you know that maybe Thanksgiving is a few weeks away, you're vaccinated or unvaccinated, it's still a very smart idea to get tested. It's better to know and to plan accordingly than to go into a situation and then potentially get other people sick.
Thank you, Erica. And again, like Erica mentioned, it's important to get vaccinated. That will help us gather safely with others. And there's still lots of opportunities here in our community to get vaccinated. So please take advantage of those and share them with your family and friends too. Offer them a ride, all this information that's valuable as well. And it looks like we do have a question from the audience. Dr. Barg, you may be able to answer this one. Ashley asks, what is the evidence or proof that shows that the COVID-19 vaccine works and is effective against COVID-19?
Well, there are numerous ways of looking at this. The one is, before this was available through an expanded access, before it was FDA approved, they did studies in thousands of people, and they followed those people to see if they got COVID, and the results were striking. 90% of the people that got vaccinated did not get COVID, and all the people that got COVID in the unvaccinated group, it was many times higher. Then all the counties have followed the hospitalization rate for people that are vaccinated and people that are unvaccinated. And to show you how well the vaccinated people work, it's many times higher to be in the hospital if you're unvaccinated. So those 2 things alone show that the vaccine is very effective. The other thing is the presence of the antibodies raised by the vaccine are substantial, and the antibodies are our first protection against the virus. People who haven't had the virus don't have any antibodies active against it. So that's why the COVID has been so bad relative to the common cold viruses, which we do have some pre-existing antibodies to.
Perfect. Thank you, Dr. Bark, for being able to answer that question. I'll go ahead and see if there's any more, but for the moment, it doesn't seem like it. Okay, we'll jump right back to Erica. So Erica, you were talking about how important it is to get vaccinated here for the upcoming holidays. Is there still time to be fully vaccinated by those upcoming holidays that are occurring?
Definitely. And I'm not sure, Stephanie, if you could share the screen so that everyone can take if you are a visual person like myself, be able to see what your deadlines are, so to speak. But definitely remember that if you do want to be completely vaccinated by the time important holidays roll around, like Thanksgiving or Christmas, New Year's Eve, remembering that the vaccines are a little different depending. So here's a good example for you. It'll break down if you want to be completely vaccinated by Thanksgiving, which is November 25th. If you choose to get Pfizer, get your first dose prior to October 21st or by October 21st. Your second dose would be November 11th, which would give you then 2 weeks after that to be considered fully vaccinated. For Moderna, first dose by October 14th, which we've already passed, so hopefully you got it. And then your second dose would be November 11th. Again, 2 weeks after is fully vaccinated. And then lastly, for Johnson & Johnson, which is only 1 dose, would be November 11th. And that's just to get you ready for Thanksgiving. You could see on the screen here, if you want to get ready for Christmas Eve and also for Christmas, November 19th, which is coming up next month, would be your first dose. And then second dose December 10th. For Moderna, first dose November 12th. Second dose December 10th, and then single dose Johnson & Johnson December 10th.
Thank you, Erica. That's a very helpful presentation. Sorry, Dr. Barg, did you have something to say?
Yeah, I might add that people shouldn't be frustrated if they can't make that exact 2-week deadline for the Pfizer or the 4-week deadline for the Moderna. If you go in at 3 weeks or 4 weeks for the Pfizer, it'll still work. And of course, if you go in for 4 weeks or 5 weeks or 6 weeks for the Moderna, it'll still work. But if you want to get ready for Thanksgiving, you got to look at these dates. Don't forget that if you're vaccinated for Thanksgiving, it'll work on Christmas and New Year's as well. You're well within the maximum protection range.
Exactly. And if you've gotten the first dose back in July and just didn't go about getting your second dose, don't think you need to start over. So just get the second dose if you need to complete your series and be able to celebrate with a little bit more relaxation with your loved ones. Definitely. So thank you for sharing that screen, Stephanie.
Yes, thank you. And again, our mobile teams are offering the Pfizer vaccine. And we do have a list of additional clinics and pharmacies that are offering vaccines in case you would like to reach out to those two if they are offering the Moderna or the Johnson & Johnson here. Okay, and one of the celebrations that is coming up is Halloween. So I know individuals are getting ready for that. If individuals do choose to participate in Halloween activities, such as trick-or-treating or gatherings, what are some of the precautionary measures that they can take during these times?
Definitely. I know that not just children are excited about Halloween or trick-or-treating, so there are ways to still be able to have a good time and celebrate. For individuals who are going to give out candy, avoid close contact with trick-or-treaters. Give the treats outdoors if possible, or we've seen some people set up stations with individually bagged treats for others to take. And then also washing your hands before and after handing out those treats, and definitely wearing a mask. If you are going to be the one collecting candy or taking others to collect candy, wearing a mask is very important. Have fun with it. Incorporate a mask in your children's costumes or yourselves. You can add whiskers or other things. And just remember that those that are younger than 2 years old should not be wearing a mask, or anybody that would have a disability or a medical condition that can impair them unable to take their put on or take off their mask. Wash and sanitize your hands frequently. It's okay to do it in between each household if you're going to be doing that. Social distancing from others at least 6 feet. I know it can be really hard with the kids that get really excited. So being able to pace, keep an eye on the next house you're going to or the next place to make sure there's enough space in between people, and then making sure that we're gathering in small groups. Other things you can do is even do outside. You could do, if you don't want to be trick-or-treating, you can do some pumpkin carving or scavenger hunts. Taking it outdoors is always a great measure to do. And then for those attending Halloween gatherings, limit the amount of people from multiple households if possible, and gather outdoors like mentioned, or with windows or doors open to be able to see one another. Wear a mask when not eating or drinking. Or if you've got loved ones or friends further away from you and you still want to get together, doing something virtually is always an option now.
Thank you, Erica. That's great guidance on how we can remain safe, especially now that Halloween is just this weekend. So definitely important to take those considerations to stay safe yourself and your family as well. And again, if you as a family think that your risk is too high, there are still all those great fun activities that you can do at home with people in your household as well. Okay, I'm gonna go ahead and see if we have any questions from the audience, either on this guidance for upcoming celebrations or in COVID-19 in general. Okay, so it looks like we do have a couple questions. Dr. Barg, you may be able to help me with these. So Bob asks, how long after receiving the Moderna booster do you see the maximum antibody increase? So that when you are at your maximum.
So it's probably 2 to 4 weeks after the second dose. So you're considered fully vaccinated 2 weeks after any of the vaccines. So it's relatively short time, but until that time, your risk of getting COVID is a little higher. After that, the risk is as low as it can be. And it will stay that way for quite a few months.
Thank you, Dr. Barg. And then we do have another question too from Miguel. Dr. Barg, you may be able to help me with this too. So they are asking a question. First, I'd like to ask, does the COVID-19 vaccine contain the live virus? Because Miguel asks, can a person who received a booster dose possibly infect an unvaccinated 5 to 11-year-old if they're not wearing a mask?
That's a great question. The answer to it's easy. It's absolutely not. It only contains a small amount of a special molecule called messenger RNA. And when that molecule goes into the cell, it directs the cell to make the spike protein, which is only one of the many proteins of the virus, and it's not alive in any way. The spike protein is transported out to the membrane of the cell, and then the immune system sees it and makes antibodies. So it's not possible to get COVID at all from getting the vaccine. Therefore, it's not possible to spread it to anybody if you receive the vaccine.
Thank you, Dr. Bark, for that clarification. So we still have a few more minutes here. Those individuals that are watching us, if you have any last minute questions, please go ahead and drop those in that comment section and we'll get those answered here in our update. If you do have any more questions after this update is completed, please still go ahead and look at comment on this update and we'll make sure to keep looking back to try to answer those questions for you all. But it looks like those are all the questions we have for today. Do any of you two have any other additional comments that you would like to make tonight before we end our update?
Erica? All right.
Sure. We do have some, I know we were talking about the flu at the beginning. So we do have in our community, we do have a few flu vaccine clinics coming up. So you can jump on our Facebook page, or we will also be updating our website with that information if it's not already on there. And there you go. Thank you so much, Stephanie. So take advantage of that if your medical providers may be backed up a little bit, the appointments are a little further out for this. You don't have to go to these, like Dr. Barg mentioned. Pharmacies can also have this available for you. But if you just want to make a day of it, a lot of these are going to be offering different resources for the entire family. And you can also get your children's immunizations up to date at the Highland School event and also at the Student Family Center, which will be November 1st. So you could kill 3 birds at one of these events, getting your flu, childhood immunizations, and COVID-19 vaccines.
Thank you, Erica. I know how important this is, and it's great that we're able to offer this to the community. Yes, Dr. Barg?
Just have one more thing. There's several treatments for the virus infection, and they're not that great. None of them work really well, but the vaccine works super well. And if you're vaccinated, you don't get sick, you don't go in the hospital, and then the hospital can do other things for people with different diseases. Right now, the hospitals have a lot of extra beds full, and they're all full with COVID. So it's hard for them to be available for all the other problems that people have. So if you get vaccinated, you'll make the hospital better.
Thank you, Dr. Barg. Yes, anyone 12 and older are eligible to get vaccinated. The Pfizer is the one for individuals 12 and older, and then the Moderna and the Johnson & Johnson are for those that are 18 and older. So definitely let's all continue to do our part. to slow the spread of COVID-19 in our community by getting vaccinated and following those public health recommendations. But thank you so much to you both for providing us more information on boosters, vaccines, and also that guidance for upcoming fall and winter celebrations. And again, we have all this information on our yakimahealthdistrict.org page. If you have any other questions, please still go ahead and continue leaving these on the video, and we will upload a recording of this video on our YouTube page, and it'll continue to be available here on our Facebook. But that will conclude our update for tonight. Gracias a todos que nos están acompañando. Ahorita en unos 30 minutos tendremos nuestra actualización de COVID-19 en español. Esperemos verlos ahí para también agarrar más información sobre COVID-19 y también sobre las vacunas. Again, thank you, Dr. Bark and Erica, for your time this evening, and we will see you next time.
Thank you, and you're welcome.